Hello and welcome to the Dentrepreneur Show.
Dr. D. Todd Russell here with Dentrepreneur. So more recently, I've been doing a lot of reflecting as I'm building this library of podcasts to share. And one of the things that popped up, a question that came up, was sort of the, what have you learned recently? Certainly, like many of you, I've learned a ton, and every day there's something new. You learn something new every day. But more recently, in the last 5-6 years, actually more like 7 years of building and running a large group practice of, currently 9 offices. What I've learned, it has to do with marketing. So let's talk a little bit about that for a brief second, and there'll be more to come down the road on one of the episodes or a couple of the episodes about internal, external marketing. But what I've learned is no matter what we do, the Google reviews we get, the websites we create, the TV ads, radio ads, billboards, et cetera, the number one thing for referrals is right here. These things. More and more I see with my young associates, it's how good are our hands. And it's not how fast you are. Speed comes with experience, but it's knowing how to do procedures. Latest and greatest technique, fine, learn it, do it, but you're not going to get fast at it until you've done it a bunch of times. The other thing is when you consider doing procedures for patients, they don't want to feel it. They want to have a pain-free experience. You could do the world's worst crown. Now, I'm not saying that you should be doing that. You should always do excellent work. But hypothetically, you could do the world's worst crown. And it's still, if it didn't hurt them, they think you did a great job. Then the patient winds up in a quality practitioner's office, goes, this crown is terrible. Patient's like, I didn't know it was terrible. It didn't hurt. Feels great. Works great. The point being, don't hurt them. When you don't hurt them, they become your voice box forever. You don't hurt them and do quality work, they're yours. They become, as I like to say to all of my associates, an annuity. Patients are an annuity. They keep giving to you in the form of referrals, trusting you with their friends and family, to as soon as they have a problem, you're the first person they call. I like to kid around and say, has anyone ever said, go to a large, not named corporate dental location, might begin with an A and end with an N? Have you ever gone to someone say, go to a blank dentist, they're all great? No, they always say, go to my guy, go to my gal, go to my doctor, because that's the number one source for referrals is still direct patient interaction. I should say direct patient referral, excuse me. So something that I've learned more recently is no matter what my company tries to do, it's handshakes and hugs. And that's always the way it's going to be. It's the patients trusting you because of your hands, how you present yourself. So thanks. Keep listening.
Thank you for joining us. Please follow or subscribe to this show on Spotify, Apple, or YouTube. If you would like further information or to meet with me one-on-one and discuss your practice, please feel free to contact me through my website, dentrepreneurllc.com. Many more exciting guests and topics are headed your way.